NHS because my dad, who was a doctor, switched to complementary medicine, and I was brought up with that. Time in the NHS taught me very quickly that there's very little in conventional medicine to do with cure. It's all to do with helping people get by with the problem that they have. So I use these particular hand gestures to try and explain a little bit about it. That is a cell that's functioning well. A cell that's functioning well in an organ or a system will mean that the cell is working well, the organ's working well, it's not ill, there's no dysfunction. But it can go wrong. And if it goes wrong and becomes a dysfunctional cell, it'll do so because something went into it that caused the problem. Stuff that should have gone into it didn't, so it started to go wrong. Stuff got stuck to the outside of it, messing around with cell wall receptors, and the cell wall tells the DNA what to do. We used to think it was much the other way around, that the DNA tells the cell, and in fact it's the cell wall that tells the DNA what to do, which tells the cell what to do. And then we got stuff outside of that which may get in the way of transmission of nutrients coming in or hormones coming in, and then you can have the actual hormones going on or other stuff going on in the body. So all of that happens to make a cell that's functional become dysfunctional. And once it's dysfunctional, ill health sets in. Conventional medicine sticks a drug on top of ill health. And that's useful. If you're an asthmatic, you can be a prize athlete, because although your lungs have gone wrong, you can use an inhaler to correct that. So you live with the problem. If you have severe arthritis, you go that way. You put a painkiller on top, you can get on with life. So conventional medicine has great value, and it's extremely effective in many conditions. But there's very little, and I'm hard pushed to come up with an idea of a drug that actually pushes a cell back to good function or an organ back to normality. Functional medicine, functional health screening is looking at how best to use functional medicine, pushes that cell back. It does so by taking rubbish out, putting good stuff in, cleaning up the debris on the outside of the cell, repairing cell receptors, getting rid of toxins in the environment, and getting distant things like glands that send out thyroxine or send out adrenaline to work properly. And out here, of course, we've also got our immune system, which is influencing nearly every part of our body. So we may have an autoimmune condition where the body attacks itself. That may make the joints go wrong, or joints hurt, as in rheumatoid arthritis. It's not really the joint that's at fault here, it's the white cell. And even that's not at fault, because what it's doing is it's attacking us, thinking that we're wrong. So the immune cell is doing exactly what it should do. It's doing it very well, but it's doing it to the wrong thing. And it's usually something out here that has told the white cell to do that. So there's that big complexity, and all of that sums up and comes up to being what functional medicine is. So functional medicine goes in and it tries to reverse the dysfunction. And integrated medicine, which is what I am, an integrated physician is what I do, is this combination of functional medicine and conventional medicine. So when we talk about the gut, shall I start now?
Yeah, give me 2
Have
seconds.
you noticed I haven't started?
I did actually. I'll just shut the door.
When we get to the gut, what we are looking at is a huge organ. And really, if you think about it, you stretch us out much like a worm. We've got a mouth, we have an anus, and a whole load of stuff goes through. But we're more complex because we've got different sections. And in those different sections, different things can go wrong. So, we're going to talk about tummy troubles. But in reality, this should be intestinal troubles, and this should be tube troubles, because we're really not just dealing with our tummy when our digestive system goes wrong. So here we have what goes on at the top of the intestinal system. and it's very relevant to what goes on through the rest. And I start with chewing because, well, I don't know if grandmothers tell us anything anymore, but we have to chew 60 times each mouthful. We should be drinking our food. And the reason is that the more we can crush things up here, the easier it is to digest. If we have an allergy to something that looks like that, and we chew it down to have lots of different bits, we're not allergic to it anymore. So that is something our immune system might attack, but that won't. So chew, really important. In the mouth we produce all these different enzymes, and they all do different things. They break down carbohydrates and sugars, and they break down fats, and they break down proteins, and this one, haptocorin, binds with vitamin B12. So when we eat vitamin B12, it actually makes it usable, because if you don't have haptocorin, if you don't have good healthy mouth and good healthy saliva, you end up not protecting it from the acid in the stomach, and it breaks it down. And I make mention of vascular endothelial growth factor because it's an extremely important aspect of potential testing nowadays. VEGF is a compound that has been found to be associated, or that's used as a tumour marker normally, with low stomach acid. So if we have low stomach acid, we don't make VEGF. And as I go through the next couple of slides, not at all, we will see how incredibly important stomach acid is to the entire health of the digestive tract. And we have the ability to test it. And I thought I'd put that up to begin with, because we are all about functional health screening. In the stomach, now having chewed up and drunk our food, we're looking at a variety of different cells there as well. Chief cells, gastric lipase is made by other cells, I forget which ones, I think it is the chief cells. They make this compound which breaks down protein. Parietal cells make something called intrinsic factor to make to utilise vitamin B12, come on to that in a minute. We've got some things called G cells that make gastrin. Gastrin is an enzyme that gets absorbed as it goes through, and it stimulates these chief cells to make more HCl, to make more pepsinogen, and we break down the proteins, and we again have an advantage of getting rid of these allergens by breaking foods down the more efficiently we do it. We also have to make mucin, because our own stomach acid would digest our stomach if we didn't have a nice thick mucus layer. But I've underlined the fact that we don't break down our proteins unless this particular enzyme is activated by stomach acid. Stomach acid breaks down food itself, but we also have to have hydrochloric acid to get this gastric lipase, which breaks down fats, and it doesn't work unless we have a very high level of acidity. Furthermore, stomach acid is extremely relevant to the things that go wrong in the stomach. So up here we have indigestion symptoms, gastritis, we have ulcers, and an ever-increasing amount of reflux. And reflux is one of the biggest problems that we face, and it is one of the biggest money spinners for the pharmaceutical industry. Which means that the pharmaceutical industry, who I've already said, don't really have an interest in getting us better. They're using conventional medicine to keep dysfunctional cells dysfunctional, us living with it. Are not really trying to encourage us to have a healthy stomach. And if you don't have a healthy stomach, you don't make the right amount of stomach acid, you end up with digestive problems. Medications, so, oops, go back. Medications, like our good old NSAIDs, the ibuprofens. Really? Am I in your way? Does that help? Is that going to throw the filming?
It's okay.
Is that better? A lot of our painkillers that we constantly take inflame our gut. Bacterial infections, Helicobacter is quite a well-known one because it's associated with stomach ulcers. That's between 20 and 50% of acute inflammation of the stomach in the United States is caused by this one particular bug. However, interestingly, the Indian subcontinent, their population, around 70 to 80% of their population, have Helicobacter pylori. They eat spicy foods and they have less evidence of gastritis, reflux and stomach ulcers. So this bug seems to be there, and it's definitely very causative and associated with ulcers, but it's not the simple picture there. There's a lot of other things that go on. If you've then got the bug, it causes a problem. And it is hypothesised, because no one's doing the studies on this, that it's the high sugar content in the Western diet and the non-protective foods that we eat, which I'll mention as we go on. Excessive alcohol consumption, all of those particular things, nothing new there. Other infections like viruses and bacteria. And this is very much helped by a lack of stomach acid. If you don't have good stomach acid, you don't kill the bugs. Extreme stress, the more stressed we are, the more our gastric cells are stimulated to make more acid, because stress tells us we're in danger. Danger means we need more energy, we need more sugar, we need to break things down quicker, so we produce more acid. And it's an evolutionary successful event to do so. But when we're constantly stressed, we start to produce too much acid. Food allergies and intolerances are a big one. And this is perhaps the most important thing on the line here, inflammation of the pyloric valve. If we have an infection that's not being killed by stomach acid, our valve at the end of the stomach, called the pyloric valve, won't function properly. Now the valve will only open up when the stomach acid content is at a very high level of acidity, a pH of 2. 1 is the strongest acid, 6 is the weakest acid, 7 is neutral, and 8 or above is alkali. We have to get to a pH of 2 to have the valve relax and open up. If we don't relax our pyloric valve, then when the stomach, which is a muscle just geared to contracting to push food through, pushes against the closed valve, the food's got nowhere else to go. And the acid that you are producing, normal levels, will pop up. And this will cause reflux, and that causes burning. So we start taking our antacids. And when we take the antacids, we cut down on our acid production. And now we're in a lovely downward spiral, which is extremely valuable to the pharmaceutical industry. I have nothing particularly against the pharmaceutical industry. They themselves are quite open and honest about it. They're a business. They're not in healthcare. They've never said they would be. They never said they are. They use it as an advertising tool. But you ask them, they're here to make money. They've got shareholders. They're a business. And they happen to have a very helpful political society that gets boosted. The fact that most American politicians are on the board of most pharmaceutical companies is a small point. If you maybe made worse by inflammation, yes, if you've got inflammation there, you are going to interfere with the production of the protective mucus layer, and that will lead to further inflammation of the stomach and the worsening of the symptoms. And it's a lot of this may be due to low stomach acid eventually, because you may start taking stomach antacids, you may damage your stomach lining, you cut down on your stomach acid production, and the infection set in, and you're now creating your own negative loop. And all these symptoms, which are excess acid, burning and pain, for which your GP will give you an antacid, may well be caused by a low level of stomach acid. So we flip back to the importance now of tests like this, because the conventional world, knowing well about this, and this comes from a laboratory called Acumen, fully registered laboratory, It's just not done anywhere else. And the only way to get a gastroenterologist to check your stomach acid levels is for you to start swallowing capsules on a tube, and then you get given an acid-creating substance, and then the tube at the end of it has a little trap on it. The trap's closed, and you pull the tube back out, and you measure whether or not there's enough acid in the tube. Fairly archaic, and now we've got a saliva test that will do it for us. So, the vital importance of hydrochloric acid: the valve won't open if you don't have enough. It breaks down our proteins, therefore reducing our likelihood of allergy. It releases minerals because you've got to break things down, you've got to get through cell walls, animal cell walls and plant cell walls for the food that we eat. And the minerals have to be acidified for absorption. That's why we can't go out and eat soil and get all the calcium and magnesium that we need. Otherwise there would be no Ethiopian-like starving nations. It kills bacteria and yeasts. Candida is a big one. We'll come on to bacterial overgrowth in a minute. And there's a little fact that Japan, as a race, they genetically seem, or dietetically seem, to produce less stomach acid than other nations, and they have one of the highest levels of stomach cancer. So, talking about tummy troubles, most people assume this is going to be a discussion on the bowel and on the flora, and it will be in a few minutes. But we overprescribe these antacids, the proton pump inhibitors. Sorry about the spelling mistake there, we've got a text on that one, it's too late to change it. The effectiveness of proton pump inhibitors, which are the drugs that go in and tell the cells, the gastrin cells, not to produce acid. The effectiveness of PPIs has led to overutilization in multiple treatment arenas, exposing patients to an increased number of potential risks. One of the things is that it increases the gastrin production. That's the hormone that's made that goes into the bloodstream and goes round to tell the stomach to make more acid and prepare the rest of the gut for food coming through. But when you do produce more more gastrin, you get a rebound hyperacidity. So you pop your pill to cut down on the acid. You feel the relief because the acid reduction's gone, the inflammation no longer has acid on it, but as soon as that drug starts to wear off, you will have already stimulated another enzyme to tell your stomach to make more acid, and therefore you have to keep taking more and more of the antacids, and they don't seem to work after a while. That said, they do keep working in many people, and you can be on these drugs for years, despite the authorities who make it saying, don't use it too much. They know all this, but the GPs have got no choice because they don't know what else to do. They're not taught, we're not taught as doctors what else to do. We'll be covering that in a moment. If you overuse these proton pump inhibitors, and it's really the same with things like Gaviscon and Rennies, but they tend to be very topical, local and short-lived. You have a theoretical risk of increased gastric cancer, higher infections. You start getting increased pneumonia because if we've got bad bugs in our tummy because we're not killing them, and we get a bit of reflux, overnight in particular, those bugs can creep up and we breathe them in. So as we age in particular, we get higher rates of pneumonia. Pneumonia is one of the biggest killers of people over the age of 75. Forget all the cardiovascular stuff and all the sexy diseases. Chest infection kills more of our elderly than anything else. Bone density loss, because if you're not absorbing your minerals, your bones get thinner. And we now have people who are getting fractures because of long-term PPI use. You get drug interactions. A lot of people have to go onto blood thinners because of cardiovascular problems, and this drug interferes with that. And then you get nutritional deficiencies. B12 doesn't get absorbed properly if you don't have the right amount of acid, because you don't make the intrinsic fat which has to bind with B12 to be absorbed lower down in the gut. And you don't get in your iron and magnesium. That may all be a little bit technical, but I thought I'd just run through this because I find it fascinating, and I like to kick off by pointing out that a lot of the other things I'm going to say, I might not be able to have the time to go through the science, but I am able to provide the science behind it. And look at that. Sales in 2008 estimated over $11 billion in America. You can understand why they don't want us to fix acid problems. Statins are the biggest drugs. Biggest drug sales, about 16 billion. They aren't very good for us either. We'll be doing a lecture on that as well. And potentially 2 billion is spent unnecessarily worldwide. What will that do to how many countries' health budgets? Come back to that one. Now the treatments, therefore, of acidity and reflux, it's not that complex, is it? You need to be careful about what you're eating. If it hurts, don't eat it. If it hurts, don't drink it. If you've got a burning tummy and you have a hot cup of tea or coffee and it hurts, just don't do it for a while. Give your tummy a chance. Avoid intolerances. If you have a sense that something you eat makes you bloated and uncomfortable, don't eat it. Baguettes. We go to France, we can eat baguettes. Have you ever noticed this? You're fine with continental bread. Two things. You may be on holiday and things are relaxed, but more importantly, they've got much more selenium in their soil. And selenium is a mineral that may well stimulate stomach acid production, and it's an antioxidant, so it'll help cut down on inflammatory response. Also, in Britain, it is by law necessary to add 6 particular chemical compounds to flour at its point of production. That can still go off to your organic bakers, because the organic bakers won't add anything, but it is law to apply these 6 compounds. These are predominantly antifungal, because if you don't kill off the fungus in the stores, then we'd have a lot more problems. But unfortunately, those chemicals, I think, trigger quite a lot of disturbance in our stomach lining. Consider taking hydrochloric acid supplements. Now be careful about that, because you have to take it in the middle of a meal. And you can buy these, they're very inexpensive, all health food stores will have them. And if you've got indigestion, it seems counterintuitive and paradoxical that you take more acid. But as all doctors were taught at medical school about this pyloric valve not opening, and all of them seem to have forgotten, if you take a little bit of acid in the middle of a meal, you will start to break down the food. And your body will get used to that slightly higher acid level, and it will then start to make more, because we've learned that if you give people courses of stomach acid, they tend to not need it. They stop having their problems, they get a bit better. And it doesn't work by itself, because you've got to try and get rid of the underlying cause. And then there are lots of natural compounds that can be used for stomach wall repair. Cyprian, a humus-like earth mineral called mamujo, licorice, artichoke cumin, there are many, many others. And there are a lot of very good products out there that will work. Now, I don't encourage people to self-medicate, but you'd expect me to say that as a private physician, but be wary. Don't just suddenly pile in and start taking lots of stomach acid and lots of herbs, unless you do a little bit of homework about it, get the dosages right, and build up. But very importantly, try and cut out the intolerances. You can test for intolerances. This is one of the better tests, and unfortunately therefore one of the more expensive ones. It's done in America, and this particular company, Alcat, measure a range of compounds released by white blood cells. Now, conventional food allergy testing looks for IgGs, and you can get for £150 odd a pinprick test that you send off to York Laboratories, and they will look at IgG. They're probably quite accurate. Their limitation is that if you haven't eaten that food for a while, because you know that you don't get on with it, the IgGs will have disintegrated in your bloodstream and they won't be there. So they have a limited efficacy. The other thing is it's not only IgG that causes allergy or intolerance. So in this particular case, we've got things that you really shouldn't have, like orange and nutmeg and plum, and things that you could have and probably won't cause too much trouble. They test a lot of others. They also look for yeasts, they look for gluten and gliadin, and they look for the milk proteins. this test also has lists of herbs, so that tells us what we can and can't give you medically and what you should and shouldn't put on your food, like oregano. It also tests for drugs, because it's very extensive and I think a very good test. You can pay a bit less and just get the food bit, but if you're going part of the way, you should go the whole way. Right, we've now got past the pyloric valve because we started to take our stomach acid, we've stopped eating the bad foods, and we've become wiser about how to look after our tummy. And there are lots of other things here. Things like weight don't help. The heavier we are around our tummies, when we lie down, that abdominal weight pushes back up and also acts as an obstruction. I should point that out. The more we exercise, the more the diaphragm massages the food through the gut, and the diaphragm is lying just on top of the pyloric valve, so it actually massages it, encourages its health, increases its blood flow. The more you exercise, the more you breathe, the more you move your diaphragm. So exercise and weight loss will markedly improve reflux and gastritis. Now the small intestine, how are we doing for time? Because that's part 1 of 4, but that's the big one. So I'm not going to go on too long in the same detail. Small intestine. Now we've gone past the pyloric valve, and we've got 30 odd feet of small intestine wrapped up in here. And each particular mil of the fluid in there, which is not yet faeces, contains about 10,000 bacteria, mostly happy with oxygen. Most people don't recognise that there are bacteria in the small intestine. They think that it's all down in the large intestine, in the colon, and surprisingly so do a lot of doctors. But that is really very important fact, because these 10,000 bacteria per mil provide a protective layer. They aid digestion and provide nutrients, and they defend against bad bacteria. So we've got a milieu of bugs in there. We used to have, apparently, when we were Stone Age, we used to have something like 30,000 different bacterial species in our gut. We're now down to about 3,000 because we've managed to wipe them out with preservatives, additives and antibiotic use. They're still doing a good job most of the time. They do a better job in the underdeveloped countries because they're less exposed to the toxins that kill them. The protective layer is covered by the lactobacillus and bifidobacteria that stick to the gut wall, so that when this particular bad bug wants to get in, or this undigested food particle wants to get in, the intact bowel wall stops it, so does the layer of bacteria. There are tough guys in our bowel, things like Streptococcus, Staphylococcus and E. coli, that are there doing a job of digesting and making stuff which we then absorb, but they also kill off the salmonella that we eat and the Campylobacter and the other things that hit the Daily Mail headline as we kill half a dozen of our inpatients in hospital outbreaks. They are all very relevant, and if they are not abundant and healthy, then we start to lose a huge range of our defence, therefore leaving us open, if the gut goes wrong, to a lot of problems elsewhere in the body. The small intestine makes lots of digestive enzymes, houses lots of digestive enzymes made by the pancreas. And the pancreas is actually quite sensitive to our well-being and our health. The most common cause of acute pancreatitis is alcohol, and the second is viral infection. So if our immune system's down or we're drinking too much, we open ourselves up to pancreatitis, inflammation of the pancreas, which will then cut down our digestive capability. The bowel wall is constantly trying to keep 10,000 bacteria per mil out, and to do so it has to have a very active immune system in the bowel wall. And the main part of that is this compound called an immunoglobulin, which binds with bad things and stops them from multiplying and going around the place. And they're called secretory immunoglobulin A. Now, when you produce SIgA in the gut, it travels around the bloodstream. So it goes all over the body, and it protects our eyes, our mouth, our nasal passages, our lungs, our throats, everything. It comes out in our skin. We have secretory IgA here, which is why we don't constantly get attacked by our own bacteria. If you make a tiny little cut in your hand, that will become inflamed, and that's your own bacteria that have just got in past the defence mechanism. This is all secretory IgA. If you don't have a healthy small intestine, you don't make a huge majority, about 50% of your immune system. These are the sort of things that happen in the small intestine. The big ones that you go off to your doctor and hope you don't have are things like ulcers and duodenitis and gastritis and Crohn's disease, celiac disease, which is a strong gluten intolerance. The conventional world loves everything to be black and white. You either are celiac or you are not celiac. There appears to be no halfway point. So people who go into their doctor say, well, if I eat a baguette, I bloat up and I get indigestion, I feel rough and I don't go to the toilet. Well, we'll test you for celiac. You don't have celiac. What you're telling me isn't true. But it is, doc. It hurts and I don't like it. No, that's fine, you can eat it. Until you become badly celiac, and oh, well, you shouldn't eat it now. Oh, you shouldn't have eaten it then, should you? So, we have increased intestinal permeability, which is more colloquially known as the leaky gut syndrome. Absolutely not accepted by conventional medicine. Gastroenterologists are beginning to accept it, and so are immunologists and rheumatologists, because they're beginning to see that things go through the gut wall, the body attacks them, and if that protein that the body thinks is a bacteria is attacked and happens to look like that protein which is lining my joint spaces, then the immune system will attack this through a concept called molecular mimicry. So we're now beginning to see the gut and the immune response being very clearly, they were beginning to see. I'm afraid integrated physicians and functional doctors have said this for 50 years. The science is there, it's just not in conventional medicine. Why not? Because we don't have a drug for it. We don't have a medicine that we can give to somebody to fix increased intestinal permeability. So pharmaceutical companies don't do studies, therefore it doesn't get into the medical press. Irritable bowel syndrome is a diagnosis of exclusion. It can and should only be used when we've taken you through all the things that it could be. So you go in, you've got your tummy problems, and we can't find anything, you get that label. But of course, conventional doctors aren't trained in the leaky gut syndrome and bacterial overgrowth. Here's a test that tells us about bacterial overgrowth. It's a breath test. If you drink a particular sugar, like glucose or lactulose, and breathe into this tube every 20, 40, 60 minutes, that line should be flat. But by the time the sugar gets through to the upper intestine, the small intestine, the upper part of the intestine, if you've got bad bugs there, and yeast in particular, they will ferment the sugars, and you get this rise in hydrogen and methane gases. And that is an indication of an overgrowth of these bad bacteria. Good level of normal bacteria, you don't get that effect with sugars. Here's a diagrammatic representation of lots of proteins that you've eaten, you've broken foods down, and there's the gut wall uncomfortably protecting you. What this doesn't show is that that lining there will be covered in something called glutathione receptors, and what your good bacteria have are a body covered with glutathione, so that's why they stick on these receptors. But when you get any disruption, any inflammatory response, or you lose your bowel flora, the leaky gut barrier is dysfunctional, and then suddenly things don't go through easily, because a lot of the good stuff we need doesn't just go through holes in the gut wall, it goes through the cell itself, so that stops, and you then get larger transitional junctions, they're called, and these larger molecules start to go through. Not good. So we can test for whether somebody's got a leaky gut or not. And what we do is we send you a pot of sample of something to drink. It's either PEG, P-E-G, which is polyethylene glycol. It's a plastic, you can't digest it, it can't be used, and it's too big to go through a healthy gut wall. But we put in very small molecules just to show that the patient has actually drunk the stuff, but they're very small and they're not likely to, you'd expect them to go through these small holes in the gut wall called transition junctions, but you wouldn't expect the larger molecules to go through. So up here, no, they should not be going through. That's the normal range there. This particular patient is walloping in large undigested molecules. That's going to be triggering an inflammatory response in the gut wall. It's going to be allowing infection in. It's going to be allowing large proteins in that will trigger autoimmune and inflammatory conditions. Once that happens, the conditions of celiac disease and Crohn's disease and other upper inflammatory diseases are going to come on. And we're going to get symptoms of this so-called irritable bowel syndrome. So we're getting pains, we're telling the GP it hurts and cramps and you're comfortable, and the GP's going, well, you don't have Crohn's, and you don't have blood in your stool, there's nothing going on, it's not a problem, you're imagining it. I'll come on to the principle of imagining tummy pains in a moment. Treatments, again, really they're quite obvious to a degree. You don't need me to talk about healthy eating. But oils are anti-inflammatory, so oily fish 2-3 times a week. If you can get it guaranteed not to be mercury-filled and antibiotic-filled and so on. So organic farmed fish is now probably the safest. Our seas are pretty contaminated. Green vegetables and broccoli have a huge range of different nutrients in them, sulfones being the big ones that are very good at helping soothe down inflammatory gut. You can use antibacterial, anti-yeast compounds like piprinic acid, grapefruit seed extract. Again, these are treatments. You need to have a look online, and you need to be talking to a nutritionist. The more severe your problem is, the more you need to pass it to somebody who will know. Most nutritionists are very expert in this. You don't have to track down integrated physicians for this. Antispasmodics like peppermint will help. Intestinal wall repair with these particular compounds. There's some fabulous combination compounds out now. There's a German company called Tiso that does a range, and they're very, very good, and they've been designed by one of the most advanced physicians in this field. Antioxidants, essential fatty acids, and good old probiotics, because if you don't have the probiotics to stick to the bowel wall, you will end up with a problem. Now we've got down to the large intestine. The large intestine's got 100 trillion bacteria. Its only job, actually, is to not let things in, because now you're down to your feces, you're down to your poo, and you don't want that back in your system. You've taken all the bits that you do want. So what the colon does is it takes water out, it takes the fluid out. And in doing so, it will take a lot of minerals as well. So we get our minerals and our water, some water-soluble vitamins, but its primary job is to form stool. There are 100 trillion bacteria here, but they're not that relevant to protecting your small intestine. But now you've got all your waste product there, so you want a nice thick layer of bacterial protection, and that's why there's a large colony down there. This is actually taken from different parts of the body. This is the front of your arm, that's your back, the heel of the nare. Oh, it's not that one. Any Latin speakers here? And I put this up because these are all skin bacteria, but if we look down here, we see lactobacillus, we see Bacteroides, and these are, there are others as well, these are all, and Staphylococcus, they are all found in the gut as well. The interaction between our bowel and the bacteria in the rest of our body is huge, and the health of our skin is based very much on our good bacteria. This one is the cause of acne, Propionibacterium acnes, and here you can see lots of people have it on their back in quite abundance. High abundance, I'm not quite sure what this is. I pulled this one up because I like to show there are so many different species that we have just living on our skin, and that's a fraction of the number that go into our gut. Large intestinal problems, things like poor motility, so you're constipated, inflammation. We all have diverticular, these little pouches that stick out between the bands of muscle that keep everything moving forward. And we have polyps and tumours, and if things are inflamed, we get diverticulitis, and we get inflammatory bowel disease, and kind of colitis and ulcerative colitis. These are the things that we would potentially have go wrong with this, and why people might come to a talk on this subject. We can have a look at compounds in the stool. This one tells us whether or not a protein is being produced by cells called eosinophils, and eosinophils are what protect us from allergy. So if they're very active, that test tells us whether we've got an allergy or not. There are others, like calprotectin, which tell us about inflammation. So in this case, we've got an allergic response, but we don't have inflammation. So this is not IBD, inflammatory bowel disease. It is IBS, Inflammatory Bowel Syndrome. But it doesn't have no cause. So inflammatory bowel syndrome, IBS, is not really a diagnosis. Something will be causing it. And in this person's case, it's very likely to be food allergy. Now, stool testing, very popular and very, very useful. The sort of levels of testing that we get back now tell us all the expected beneficial bacteria. There's the lactobacillus and the bifidobacteria. But those two should have 4+, and we should have quite so many of everything else, because those two should make up about 30 to 50% of our bowel bacteria. In this case, there's an overgrowth of bugs that aren't causing us any problems, but they're not helping because they're eating the food that these guys should be eating. And here, we've got a bad one, Citrobacter. That's quite capable of causing inflammatory responses. This person's also got some candida. It's a normal flora, we see it, but if it's overgrowing, then that can become a problem. Whilst it's in the gut, it may not cause you an issue, but if it comes out and pops itself into the vaginal vault or into moist cracks in the buttocks or in the groin, you start getting fungal infections. And once it's there, you scratch, you've got it on your nails, you do that, and you've suddenly got it in your mouth, you chew your fingernails, and suddenly you've got candida in the wrong place. So whilst it's a normal flora, we don't really want it there. These tests are good because they actually give us natural products that will kill the bad bugs. It also gives us the drugs that we can use. So if we're failing to find an answer through a natural approach, we can always use this. This is a tough guy. It's not going to die off if you give it these common drugs. You've got to go into some fairly heavy ones. The yeast, we get to know what we can kill the yeast with. We occasionally find parasites. This is a controversial one because many people, most gastroenterologists don't consider it a problem. But in reality, if you decide to become allergic to blastocystis, and you've got this lining your gut wall, you're going to trigger inflammatory response, which is why many people who have it don't have a problem, but some people do. We get a range of different activities going on, and we can tell us lysozyme is another inflammatory enzyme. It's an enzyme secreted at the site of inflammation in the GI tract. So is lactoferrin. Lactoferrin tends to rise more in food intolerance, along with the previous one. Down here, I've put this one in because there's that secretory IgA that's so important to your immune system, and it's not happy. It's very low. And we've got inflammation, and we've got bad bugs, and we've got parasites. And here's this person, I can't remember exactly what this particular individual's concerns were, but they're not going to be happy bunnies. And just to show that sometimes we can get things that are quite normal. Treatment for the large intestine, once again, get back to that high fibre. Let's keep that stool cleaning the bowel, and let's go through looking at the natural plant options that we can use, but it's not that dissimilar to the small intestinal. So to end with, the gut-brain axis. We've known for a long, long time that what goes on up here hits the tummy. We have gut feelings, we get butterflies in our tummy, we are very well aware that we can alter our bowel habits simply by being anxious and nervous. Ask any bunch of students going in for an exam how often have they been to the loo that morning. And this is because adrenaline up here tells me I'm frightened, because the receptors on my brain say, well, be anxious. But adrenaline receptors in my heart make my heart go quicker. So they're speeding up my heart rate. But down in my gut, they're saying, right, we're about to go running, and we're about to go get into a fight. And if you're going to have to run away, you really don't want a full bladder, and you don't want a full bowel. So you watch any wildlife program, watch the lion spring out on the antelope, and the antelope will poo. If we're very frightened as humans, and you watch a lot of silent witness type programs, you will see them lying in their own excrement. And this is because the adrenaline has caused the gut to do this, and the bladder to do this, and everything to go out. Now this occurs because the receptors there say, right, we don't want you moving, and we also don't want 2 litres of blood in the gut doing nothing to help us run quicker. So the blood vessels contract down, the blood leaves the gut muscle contracts down, you get tummy pains, and an extreme adrenaline response, you defecate. Now, if we're living our lives getting up too early, staying up too late, taking in too many toxins, stressed at work, stressed at home, then of course what we're doing is we're not having the sudden need to go to the toilet type adrenaline rush, but we are certainly getting a very persistent amount of adrenaline that over a period of time cuts down the blood flow. Without the blood flow to the gut, it's not going to move properly, and it's not going to be very happy. So what we have is we've known this, and that's not a problem. But in the last 5 years, they've actually established a professorial chair at University College Hospital who is a psychiatrist who works with gastroenterologists now, because gastroenterologists kept saying, we don't know why we're having to cut these people's guts out, because we don't know why they're constantly inflamed. But we think that there's a lot of psychological issues here. And the psychiatrist has come along to work with this, but through this professorial chair, they now know it works the other way around, because 50% of the nervous system is in the gut. It would be. There's 30 feet of gut to keep moving, and muscle squeezes down under nerve control. There are a lot of adrenaline receptors there. So when you do something that inflames your gut or makes your gut unhappy or puts it into spasm, the nerves down there will be activated by their own release of their own adrenaline. So if you've got a large amount of nervous tissue down here producing adrenaline to tell the gut what to do, that will travel around the bloodstream and travel up here and hit the receptors here saying, I'm worried. Many people will get an increased heart rate after they've eaten. And it doesn't happen often, but you can eat a meal and you'll sit there, having enjoyed it hopefully, and you think, oh, your heart's beating a bit hard, a bit fast. This is because you've taken something in that the bowel has said, not happy about this, or you've just overeaten. And the bowel is having to work that much harder. So the nerves are having to work harder to tell the muscle to work harder. That's an adrenaline or an adrenaline-like hormone, and that's hitting the heart, so your heart rate goes up. Your breathing rate will go up. Everything that you should do with adrenaline goes up. But the big one, it comes up and hits the brain, so you get anxious, you get depressed, you get insomnia. And that process, because now you're worried, tells the brain that there's something going on, so it produces more adrenaline, which then goes down and perpetuates the activity of the gut. And you're now in a fairly difficult vicious cycle. So you go and see your GP, he thinks you're nervous and anxious, so he gives you an antidepressant or an anti-anxiety pill, and that cuts off that response, but he doesn't know anything about the gut. So you no longer feel quite so anxious, but your tummy's not better. So you go back and say, well, I've taken it for 3 months, I've still got my tummy pains. He goes, oh, well, they'll take it for longer. If you've got somebody like a nutritionist who can't prescribe an antidepressant, they'll work on your gut, and they may well soothe the gut down. But now you've got your brain, who's been activated by the adrenaline, thinking there's a problem. And it will have fixed on something. If you're all okay, and your brain is telling you you're anxious, it will go out and find something to worry about. So a small problem will become a bigger one. And you're now locked into that, and that will aggravate the gut. So, we now have the gut-brain axis, which is different from the brain-gut axis. An alteration in behaviour, cognition, emotion, altered levels of inflammation all come about because of this cycle of adrenaline response. We can measure that. We can do urine and saliva testing to have a look and see what all the hormones are doing in your nervous system. And here we can see a very high level of serotonin, which is one of our happy chemicals. It's doing its best to try and stop us being over anxious, because here noradrenaline, which is actually more active in the body than adrenaline, is very high. The actual adrenaline levels are a bit low because the body's trying to drag down the adrenaline levels, because the noradrenaline, which is much more potent, is much more active. Meanwhile, the body's trying to get you a bit happier, and things have started to go out of balance. And now, the glutamate comes up, another excitatory hormone, and everything's just working too quickly. So you're now going to start producing too much acid, and you're going to start producing too much spasm, and the ratio is too high, or rather technical. And the beauty of some of these tests here is that that's not readable sadly, but it tells you all the different natural products that you can take to help rebalance that. There's no point in rebalancing that if you don't deal with the gut issue in the first place. So you've got to take this into account. If your GP is failing you, and your antidepressants are failing you, and your probiotics and your diet are failing you, you have to bear this in mind. So it's important to know a relaxation meditation technique. You use up adrenaline by exercising and doing Tai Chi and yoga, which all of those will help the breathing, and that will help the upper intestinal issues. Look at something like self-hypnosis or neurolinguistic programming. This is a cheating way of becoming a good self-hypnosis person, because it's a technique that gets you with your current anxieties and worries to go and talk to you when you first, in your imagination, to you at an age where your problems first started. And if you have a chat with your little 7-year-old self or your 14-year-old self and say, do you know, it's okay, I'm really grateful that you pumped out all that adrenaline because Mum was beating Dad up. But, you know, I'm old now, I don't really need to have that fear anymore when I see people fighting. It doesn't have to trigger the same adrenaline response. So thanks very much, you did a really good job then. You needed the adrenaline then because you didn't know what was going to happen when your father finally died under the axe of your mad mother. And but I don't need it now. And just a simple conversation, and suddenly a whole attitudinal change occurs because of your response to relationships. That's not a personal story. It might be for my children. Restriction of stimulants. If you stimulate yourself, coffee, alcohol, drugs, cigarette smoking, you'll eventually drop your happy juice, dopamine. Without dopamine, you're not motivated and you're not, you don't find pleasure in things. But in the gut, it's a complete no-no. If you don't have enough dopamine there, you can't stop the contraction and you get spasms and all sorts of things. Lots of amino acids can be used, there's herbs that can be used, St. John's wort's quite well known, and we can work on the dopamine with this particular herb from the Far East. So, that's the story, that's what we leave up, because that's what we do, and we are open for questions, but we should also open a door or a window. So, was that of help?